Welcome to this episode of Look Around Lubbock, brought to you by Fox 34. Hi, I'm Kurt Kaiser, and I'll be your Look Around Lubbock host over the next several months as we explore the medical community in Lubbock and the surrounding area. Lubbock is the medical hub for the citizens of West Texas and eastern New Mexico. The Lubbock area medical community offers the highest quality advanced health care in the region. Medical providers strive to provide services that encourage healthy living and address serious healthcare concerns. Look Around Lubbock will inform viewers about many of the exceptional medical services that are available in the Lubbock area. I hope you'll join me every weekend right here on Fox 34 News Now to learn about many of the healthcare services available to the people of West Texas and eastern New Mexico. Your healthy lifestyle begins with education about the excellent medical services available to promote exceptional healthy living. Advanced Limb and Brace restores lives. They specialize in prosthetics and orthotics for all ages.
Orthotics is any kind of bracing from head to toe, and prosthetics is anytime someone's missing a limb. We make a prosthetic leg or prosthetic arm or whatever they might need. But when someone loses a limb, they've described it as losing a family member or something to that extent. So we want to be there for them, support them, let them know there is hope, and a big portion of this is mental. We say 80%, that's just kind of a guess, but you can do as much as you think you can do.
You have to have empathy, you have to have sympathy, compassion, all of those things to deal with what some person goes through when they lose a limb.
While there may be tragic circumstances that bring people into Advanced Limb and Brace, the success stories that follow their patients is what truly touches Jeff Peterman.
Seeing them get up and walk for the first time, when they lose a limb, they think their life is over. You know, how will I ever deal with life again? How will I ever be able to get around again? How will I ever function as a person, as a human being?
There's also emotion when a parent brings their young baby in with skull issues. Advanced Limb and Brace specializes in cranial remolding orthotics. That's helmets for young babies.
There's different types of head shapes that are involved. There's scaphocephaly, brachycephaly, and plagiocephaly. Plagiocephaly being the most common as it's seen in the helmet. This is a typical helmet, but basically we want to correct misshaped skulls. Basically the way the helmet does that is we grab onto the rounded portions, that way they grow faster into these flattened areas so that the skull look more symmetrical. Most of our patients are between 5 and 8 months old. We can do some earlier, but usually you see quite a bit of improvement on its own in the first 4 to 6 months. Once we get past 8 months old though, we start to worry about getting close to that year mark. Once we hit that year mark, how much we can improve it really slows down. I haven't seen any improvement past 15 months. The skull starts in just kind of 5 different bones that later fuse as you get older and they get harder. And also some of the helmets we do are because some of those bones fuse early, in which case the patient would need surgery to remove it, and then we'll apply a helmet to help correct the way that the skull grows.
Over the years, the advancement of technology has improved the services they now offer.
When I got into it, the hands would just open and close. Now the fingers move independently. It's just incredible. People are playing the piano that have lost both arms.
So how did Jeff get into the business that he now considers a mission, not a job? It all started in 1979 when he was laid off as a welder and answered a blind box ad in the newspaper.
Nobody was hiring back then, and I answered a blind ad in the newspaper for looking for a position with somebody with good hand skills, good work ethic, high-tech medical field. And when I went in for my interview and saw that it was prosthetics, I knew what prosthetics was because I have an aunt that was an amputee since I was a little boy. And I eventually got to make her an arm.
Jeff Peterman, along with his staff at Advanced Limb and Brace, has been helping many others ever since at both 34th Street in Lubbock and in Amarillo. Meet Yomi, bringing the power of surgical robotics to dentistry at Caprock Oral and Maxillofacial Surgery. This is a real coup for Lubbock to have access to this relatively new technology.
There's only 110 in the country. The 110 were primarily East Coast, up and down the East Coast, and some of the West Coast. Now, there's a couple in the Dallas Metroplex. I'm the only one that has the Yomi robot or uses it between say Fort Worth and Phoenix, Arizona now. The robot that we use called the Yomi robot, its production is in Miami by a company called Neosis, and Neosis means new cut in Latin. And so it is the first FDA approved robot to use in the field of dentistry, specifically implant dentistry.
As a restorative dentist, we have a lot of need for precision in that aspect. If we get to actually put the smile back together, put the tooth in the missing space, so to speak, and so that part of it, sometimes it just requires a little extra precision, and it just, having a robot be able to help the team to be able to make that look as great as it can is a big advantage.
And I think the robot over the next 10, 15 years will become a mainstream in the field of dentistry. By then, they have robots maybe to do other types of surgery in dentistry. I've been doing it for a long time. I take pride in my work. I think I do good work. However, when you talk to some of my referring doctors, they can tell you, they can tell a difference between when I used the robot and when I didn't. You can't replicate the accuracy. It is so precise, the room for error is zero.
I really work in a system of not only millimeters, but sometimes tenths and hundredths of a millimeter. And we need every bit of precision that we can muster.
Recovery, we've talked to our patients recovery-wise, it's virtually painless. I don't even make an incision anymore. Okay, it's all incision-free. Recovery is much faster. It's the cutting edge aspect of dentistry, right? I think right now. It's something that, if we can get it, it's a technology that if we can work it and utilize it to its full potential, that's going to be all the better for the patient.
The use of the robot is the true definition of teamwork.
And when it's a situation where I don't have quite the right, maybe placement of an implant, I tell them about it and say, hey, that really wasn't in the right spot. We'll make some corrections. I try to coach him on what it might be that he could do to help me with what I'm trying to do. He can make some corrections in that and say, okay, I know what you want now.
If I'm placing an implant, I could place it, and before I'm done, I'll put a pin just to make sure I like the alignment. If I don't like it, in real time, just like that, we can change it on the robot, and then I can go back in and alter maybe something by 0.5 millimeter, 3 degrees. Doesn't seem like a whole lot, but in the mouth, it is a lot.
Dr. Fanous has been using this robot-assisted surgery for around 6 months. The learning curve was high, but the advantages are higher.
For me, technology is everything in medicine, in dentistry, in healthcare. And this is, in my opinion, the new cutting edge of technology in the field of dentistry.
Physical Therapy and Balance Center, located on Indiana Avenue in Lubbock, is unique. That uniqueness starts with the name.
We are physical and spelled different because we are different. But in addition to that, just speaking about physical therapy in general, there are a number of things that can be of benefit for a patient. We can help reduce the need for pain medications. We can reduce fall risk, and that is one aspect of what we do here that I feel is very unique.
Here at Physical Therapy and Balance Center here in Lubbock, we start off with an examination, with an evaluation, where we are assessing each patient's different levels of loss of function, loss of ability, and look forward to addressing their goals.
One of the key areas they work in is balance and gait training.
We are looking at individual sensory integration or sensory interaction that they have upon their balance. And we use different systems to help us with our balance and to help us with our gait. One of our sensory inputs that we utilize is our vision. We all use our eyes to know where we are in space. We all use our eyes to know where we are on the horizon. Am I upright or am I lying down? Where am I in space? And then the other major system that we also evaluate and are assessing is our inner ear, not the part that we hear with, but the part that we refer to as the vestibular system, to know whether we're moving forward, backward, turning left, turning right, moving up or down.
Each person is entirely unique, and in as much the way we approach to take care of each person has that uniqueness and individuality.
Physical Therapy and Balance Center also offers aquatic therapy.
Therapeutic properties of the water include buoyancy, which helps offload or reduce the effect of gravity for a variety of orthopedic afflictions. An ankle sprain or arthritis in your hip or back pain, you can move in the water in ways that you simply can't move on land because of pain or weakness. So the water is a nice segue to help restore that movement quality. And with arthritic patients, the warmth of the water is really helpful in relaxing the muscles and helping the body be more willing to move.
Half of our patient population is about 65 and up. As I age, I realize more and more that there's just normal change each decade of life. And we want to meet people where they are no matter what their age is. We want to get older well. We want to age well with great function and great quality of life.
We're not just throwing spaghetti on the wall and seeing what sticks, that we do have evidence-based approaches and have research outcomes that we know what works and how to officially implement and progress that. I love what I do because I never have the same day twice. And I truly enjoy being able to impart to someone else, to a patient, any information that or knowledge I have that could help improve their quality of life.
I get to love on people, Kurt. God has blessed me with insight and abilities that are not of me, and I get to share them with others and help them achieve the things that they want in their life so they can love their life and have their quality of their life.
Healthcare closer to home. That's the vision for the Lynn County Hospital District. In order to accomplish that mission, they have seen recent expansion.
We now have 3 physicians that work here. We actually have 5 nurse practitioners and have a clinic available 6 days a week with nurse practitioners and physicians combined. Obviously, we have an emergency room that's open 24/7. The win or the positive for me in that regards is I now have those individuals on staff, so I'm not having to use agency staff to cover my emergency room. That my team of medical staff, we cover 95% of it within.
That growth has expanded to other communities.
Got a grant down there and put a new family practice clinic there. Have 3 providers that cover that facility on a variation of schedules. We actually reached out, Gale, Borden County, we had been working with them with the school, and they reached out to us and said, would you put a clinic over here? And I said, sure, we need a space. And so they gave us one of the cottages or the houses that the teachers normally live in, and we converted a house into a clinic, and we're there 2 half-days a week.
Rural hospitals face several challenges, especially one that is so close to a major market like Lubbock.
The main challenge we have is to be competitive. And how do you be competitive when 30 miles up the road there's 2 big guys that do it a lot bigger than I do? And so we've had to really decide here at Lynn County, what services are we going to provide, and of those services, what makes ours one step better than the next person down the road. We're not going to try to be anybody that we're not. but the services that we offer, we're going to do it just a little bit better than the next guy. We're going to be the entry into service for anybody that has a healthcare need, that if we can't fix you, then we're going to team with you until we find somebody that can take care of your needs.
While there are definite challenges, there are also many advantages to serving a smaller community.
Our vision is healthcare closer to home, and I think that, you know, you deal with people every day when they're broken or they're sick and they're scared, and nothing makes you feel better about being at home. And if you can't be at home, you'd rather be around people that know you and care about you. And so that is a huge advantage of being in a small rural community. The patient will go and see Dr. Martinez, for example, and he loves to take care of diabetes and does a lot of stuff with weight loss and obesity management. And they'll go in there and say, you can do exactly what my endocrinologist is doing. You can manage, you're saying the same words, you're making the same plan. Why can't I just stay here?
Melanie Richburg is a unique CEO, one who has practiced medicine and now leads that same organization.
Sometimes my employees would say it gives me a home court advantage because I know what I'm asking you to do, because 9 times out of 10 I've done it myself numerous times.
The CEO wish list for the future is a new emergency room, a primary care presence in every town in Lynn County, and also an adequate long-term care option for the elderly.
I have about 157 people that depend on me to make the right decision every day. I've got over 30,000 people in this county that come to us for care that depend on me to get the best 157 people to take care of them. So to say I don't have much pressure, nah, I don't have much pressure.
The Nutrition and Metabolic Health Initiative is a busy place.
So the Nutrition and Metabolic Health Initiative is a clinical research facility that is home to many faculty, 5 from nutritional sciences, and campus-wide if people need to use the facility to do their clinical research studies in areas around obesity, metabolic disease, health and wellness, and that sort of thing.
The initiative also provides clinical services to the community in weight management, nutrition counseling, obesity management, and can provide guidance in leading a healthy lifestyle. They also train students in community outreach.
We have over 25 students here that are engaged in everything we do. They work with our patients and they also are involved with our research subjects. We recently had our first high school training program. We invited a small number of high school students from the community to come and learn about everything that we do here. It was a week-long event that's going to continue.
Weight loss and striving to lead a healthy lifestyle is not a new fad.
People have been trying for a very long time, and there's a lot of not so ideal information out there about what to do and what not to do and so forth. I think what's improved in recent years is the expert knowledge that's more reputable and a bit of a reduction. It's never going to go away, but in some of the snake oil kind of approaches to health, wellness, and lifestyle. We work on it through, myself and my colleagues have been working for years to improve the messages that are out there, to work with industry, like the food industry, to try and help with some of the marketing aspects of food and exercise, to get a better, more balanced message out there.
There are various ways NMHI can help their clients, starting with blood work.
We're measuring hormone levels in the blood that influence whether somebody feels full when they eat or when they feel hungry, and how those respond to eating, how those respond to cues in the world. There's the metabolic cart, which basically measures how your body exchanges oxygen and carbon dioxide in a way that tells us how many calories somebody needs when they're at rest. And so when somebody comes in for studies or for clinical work, we can tell pretty much what their body needs, and that's helpful in setting various calorie goals. Everybody's quite different. We can see how metabolism changes in response to doing healthy lifestyle and diet and exercise and so forth. If you do a complete lifestyle approach to weight management, you will see a nice balance of lean and fat loss. So that people lose overall, they're losing a much bigger percentage of fat versus muscle and so forth.
Dr. Bink says that the world gets in the way of a healthy lifestyle more than we do.
Your work life, your social life, your stress management, how you cope with emotions, all of those things influence your ability to commit to health. And people think that it's personal shortcomings. Like, if I was a better person, I would eat better and exercise, and if I knew more. But really, it's about how do you implement. You can make a difference in your health by eating better, exercising better, managing your overall lifestyle. You're still working against a body that sometimes isn't helping.
NMHI at University and 19th can get that body working better for you. Healthy lifestyles begin with becoming an educated consumer. Thank you for watching this episode of Look Around Lubbock, and I hope that you've enjoyed learning about new state-of-the-art medical practices available in the West Texas region. Join me, Kirk Kaiser, every Saturday and Sunday afternoon as we continue to feature medical providers dedicated to promoting healthy living. Watch right here on Fox 34 News Now. Discover your path to a healthier lifestyle.